Now we are going to take a look into the axilla, and after that we will take a transverse section of the axilla. There are questions appearing on the transverse section of axilla. See, the axilla is basically the armpit, and it will have some walls: anterior wall, posterior wall, lateral wall, and medial wall. So that is where we are focusing now. You see, this is the axilla or the armpit, and as you are talking about the anterior wall, it is pectoralis major and pectoralis minor muscle. What about the posterior wall? Posterior wall, we have seen there were three muscles, and one of them is the latissimus dorsi, and along with that there was the teres major and also the subscapularis muscle. So posterior wall of axilla, it is the latissimus dorsi, and along with that you have teres major and the subscapularis muscle, three muscles, posterior wall of axilla. What about the lateral wall of axilla? We have seen that there is the bone humerus, and also it is the long head of the biceps tendon there. And what is the medial wall? Medial wall is actually the upper four ribs and along with the origin of the serratus anterior muscle. So medially, it is the upper four ribs along with the serratus anterior origin. Now what we do is we will take a transverse section of the axilla region to see the boundaries and the content also. As you do that, you will find the medial bone is the ribs, upper four ribs, and posterior bone is the scapula, and lateral bone is the humerus bone. Humerus bone is having a lateral lip of bicipital groove, a middle lip of bicipital groove, and this is the bicipital groove where you have the long head of biceps brachii. Understand, when you say this is the medial wall, which is the upper four ribs, they'll be giving origin to serratus anterior, and insertion is on the medial border of scapula. And what about the muscle under scapula? Muscle under scapula is subscapularis muscle, and it is on the posterior side. If you say this is the muscle under the scapula, which is subscapularis muscle, which is on the posterior side, then what is laterally? Actually, there is a muscle coming from the dorsal scapula, and that muscle is called as the teres major. Teres major inserting on the medial lip of the bicipital groove, whereas the lady, the latissimus dorsi from the lower back, is inserting on the floor of the bicipital groove. The muscle which is attaching to the lateral lip of bicipital groove is the pectoralis major. If you remember, pectoralis major came from the costal cartilage of the ribs, and undercover that is the pectoralis minor, both forming anterior wall of axilla. This is the diagram which we are supposed to draw. You will also see that there are contents inside the axilla, like you will find there is axillary artery, axillary vein, and the three cords of brachial plexus. The cords of brachial plexus are named according to the relation to the axillary artery: posterior cord, lateral cord, or medial cord of the brachial plexus. This is the diagram which we will be drawing now. So as you draw this transverse section of the axilla, you will see the bone which is on the medial side will be the ribs, the upper four ribs. Now if you say it will be the upper four ribs, they'll give origin to serratus anterior muscle forming the medial wall of axilla. Yes, medial wall of axilla. Then what will be in the posterior wall of axilla? Posterior wall of axilla, we have the scapular bone. So there is the scapular bone which is on the posterior wall of the axilla, and when you are talking about the posterior wall of the axilla, you'll have a muscle also under scapula which is called subscapularis muscle. So this is the muscle under scapula which will be the subscapularis muscle. And then what is in the lateral wall of the axilla? Lateral wall of axilla, we have the bone which is called as the humerus bone, and this humerus bone is having actually a groove here which is called as the bicipital groove. It is called as the bicipital groove because that is where you have the tendon of the long head of the biceps brachii. So bicipital groove will have the tendon for the long head of the biceps brachii there. Also, you will see there is a medial lip of the bicipital groove and lateral lip of the bicipital groove. Now, once you have that orientation, you can tell which muscle are inserting here. Actually, there is a muscle which is coming from the anterior lateral aspect of the ribs and inserting on the lateral lip of the bicipital groove, forming the anterior wall of the axilla, and this is called as pectoralis major muscle. So what is the origin insertion of pectoralis major? It is actually anterolateral surface of the ribs, and insertion is lateral lip of the bicipital groove. Under cover of that is a small muscle which is called as the pectoralis minor muscle, and along with the pectoralis minor and major, they are forming anterior wall of the axilla. If this is the anterior wall of the axilla, then what is the medial wall of axilla? Medial wall of axilla, we have this muscle taking origin insertion. So what is this muscle? Origin, lateral, anterolateral surface of the ribs, and insertion. Insertion is on the medial border of the scapula on the anterior surface, serratus anterior surface of the scapula. So anterior surface of scapula, middle border of scapula. Yes, if you say that is the anterior surface and also medial border of the scapula, fine, that is the origin and insertion of serratus anterior, forming which wall of the axilla? It is forming the medial wall of the axilla. So here it is forming the medial wall of axilla. Then which three muscles are there in the posterior wall of axilla? Posterior wall of axilla, you have the scapular bone with three muscles. One of them is under the scapula, we call it as subscapularis muscle, and then one came from the lower back. The muscle which came from the lower back is going to insert into the floor of the bicipital groove, and this muscle which is inserting to the floor of the bicipital groove, you see this muscle which is inserting to the floor of the bicipital groove here coming from the lower back is called as the latissimus dorsi, and this latissimus dorsi is followed by one more muscle in the posterior wall of axilla, and that came from the dorsal aspect of the scapula inserting here. So you are telling that this is the muscle which is called teres major muscle. Yes, the teres major muscle, which is actually on the lateral border of the scapula but dorsal surface. So teres major coming from lateral border of the scapula but dorsal surface. Yes, an insertion. See, teres major come from the lateral border of scapula, dorsal surface, inserting into the medial lip of the bicipital groove, and then there are three muscles in the posterior wall of axilla. They are teres major and the latissimus dorsi and the subscapularis. And what are the two muscles in the anterior wall? Pectoralis major or minor, and one muscle in the medial wall, that is the serratus anterior. And what are the contents? If you say contents, let me magnify the area and discuss. You have to draw a carotid. This is the axillary sheath now. So this is the axillary sheath. What is inside the axillary sheath, you remember? Inside the axillary sheath, I have the axillary artery, and along with the axillary artery, what do you have? I have the three cords of the brachial plexus. One is posterior, one is lateral, and one is medial. So this is posterior, this is lateral, and that is medial. Yes, and there is a vein also, and which is outside the axillary sheath. Let us magnify the area. What is this about? You are telling this is the content of the axilla, and this is the axillary artery. So content of the axilla, this is the axillary artery. Where is it? It is inside the axillary sheath. This is the axillary sheath. So this is the axillary sheath now. Yes, that is the axillary sheath. Inside that is the axillary artery and the brachial plexus. Are you trying to say that axillary vein is outside the axillary sheath? Yes, you remember this, that the axillary vein is outside the axillary sheath. Then what is inside the axillary sheath? The artery and the related chords of the brachial plexus. If it is behind the artery, posterior chord of brachial plexus. If it is lateral to the artery, it is the lateral chord of brachial plexus. And if it is medial to the artery, medial chord of brachial plexus. Do you remember? Posterior chord of the brachial plexus will continue as the radial nerve. And what is the lateral chord of brachial plexus continuing as? The musculocutaneous nerve. And what is the medial chord of brachial plexus continuing as? The ulnar nerve. That will be the ulnar nerve.